It's Jace again. I'm going to go ahead and give another quick recap of what my project is, and then I'll get into the three pillars of innovation that we are required to go over. So, my project idea is a website called the Value Base, and the purpose of this website is to collaborate with small and large health systems as well as state and federal health agencies to help educate and help health systems successfully implement value-based healthcare concepts in their own practice. So we're going to have training modules, we're going to have video and lecture series, written curriculum, newsletters, research papers, everything that you can think of focused on value-based healthcare that these that these health systems can subscribe to our website and successfully learn how to implement these concepts in their own organization. So that's my website. The three pillars that we're supposed to cover is information technology, finance, and the innovation and policy. So for our information technology plan, we're completely reliant on having a successful data sharing and computing website. So we're relying on health organizations sharing their data with us to take advantage of some incentives that the CMS can offer. So we want that to be a good experience for these health organizations. So we're going to be using Google Cloud Sites. It's a highly rated website development as well as cloud service. So that way these health organizations can share their data with us as easy as possible. We'll be hiring a PaaS team to develop and maintain the website. And then, of course, we'll be using a 128-bit encryption code to protect all the data within our website. So that's our IT plan. I'll go ahead and move on to our finance one. We'll be applying for a $2.6 million grant from the CMS. The CMS is one of the largest stakeholders in health organizations implementing value-based healthcare concepts. So I do believe that we have a good advantage of actually getting this grant. And then, of course, we have cost-specific sheets that that I'll be throwing up, and that way you guys can see exactly what this $2.6 million grant is going to cover. The 3-year costs, that's what this grant will cover, is the first 3 years of our program. The costs include web development and upkeep, salaries and benefits, rent, office supplies, and insurance and legal fees. There may be some other miscellaneous fees, but this pretty much covers exactly what that $2.6 million grant will be used for. The way that we're actually going to be making money is we have a $129 subscription fee annual. So it's not very expensive. It's only about $11 or $12 a month, and it's per user. So if you look at one hospital or one health organization, there could be dozens, if not hundreds of people that could potentially become a subscriber to our website, especially if the C-suite or the leaders of that organization require all of their leaders to subscribe, and that way they can learn value-based healthcare concepts and implement it in their own department or their own floor. And then the only costs that the grant will not be covering are the income taxes that we receive through our subscriptions. And of course, those subscription fees are what's going to pay for those. And then, of course, bonuses and employee shares. And then our innovation and policy. One of my favorite books that we read throughout this program is the Innovate Like Edison. And one of the greatest lessons I learned from him in creating an innovative atmosphere is to have little to no rules in the workplace. He pretty much let his team work when and how that they wanted, as long as they completed their tasks, and they became completely loyal and devoted to him and the success of his business. So I want to be able to do the same thing. I want to be able to hire people who are creative and can innovate, and they know their tasks and they know how to do it best. I've worked for companies that are really rigid and strict in how you accomplish tasks. However, my belief is that whoever is performing the job can typically create the best way to do it. So as long as they know what they need to get done throughout the week, I believe that setting your own schedule and your own time off is crucial to gaining loyalty through your team. And obviously, if tasks aren't getting completed, then we need to step in and talk to them about it and make sure that things are still getting done. But I do want to create an atmosphere where people have autonomy over their role as long as they're getting them done. And we will also have employee shares in the profits. That way, people have more incentive in the success of the business, and that we can become one collaborative team who are chasing the same goal of bettering our healthcare system and also bettering the success of our organization.